Every agency represented here today in some way contributed to this operation, be it the undercover controlled purchases, managing informants and information, obtaining information from traffic stops, and on and on. I want to especially recognize and thank the detectives who put so much time into investigating and building solid cases against drug offenders in our community. They have done a tremendous job, and they deserve our thanks and our respect. I certainly like to recognize and thank District Attorney Scott Thomas, his assistant district attorneys who prosecute the cases, and his administrative staff for all their hard work managing the caseload that results from our efforts. A lot of work goes on behind the scenes, and all are to be commended for the great jobs they do. I'd like to thank Nick Wilson from our office for all the work that he does with our operations and managing the information that we put out to the public. He has created videos for our past two operations, and he manages our social media. Providing information to the public is very important, and he does a great job for all of us. As always, and on behalf of all of us, I'd like to thank the citizens of Carteret County. We work for you, and you deserve to have a safe community where you can live, work, and enjoy your lives. Thank you for your partnership and your support. We have taken a strong stance here in Carteret County, and I believe that all of our efforts have paid off and have made a positive difference. We all stand here today to send the message that all law enforcement agencies operating in Carteret County and the surrounding area are all on the same page, and we are working together. In the area of drug crime, we have one mission in mind: protecting our communities and bringing drug dealers to justice. Operation Hourglass is the fourth such operation we have rolled out in the past 2 years. Operations Pill Crusher, Who's Next, and Winter Storm have seen the arrest and prosecution of over 300 drug dealers in our county. Operation Hourglass will significantly add to this total. As of today, we have arrested 17 suspects in this first round. As we have done in the past, we will make numerous arrests over the coming weeks. Time has already run out for this first set of suspects, and time will soon run out for many, many more. We have targeted approximately 100 drug dealers in this operation, and soon they will be brought to justice for distributing heroin, cocaine, methamphetamine, prescription medication, LSD, and other drugs in our community. At this time, I'd like to recognize District Attorney Scott Thomas for his comments.
Thank you, Sheriff. Today we announce Operation Hourglass, an undercover drug investigation in Carteret County. I'd like to commend Sheriff Buck and these police chiefs for all the work that's been done in this case. This operation has required a lot of time and a lot of effort, and a lot of work, as Sheriff Buck mentioned, has been put into it. Assistant DA David Spence and Michelle Gillikin in my office put forward a considerable amount of time in working with the sheriff and working with the police chiefs in this operation. We understand that an operation like this requires a lot of work, a lot of teamwork, and a lot of effort. There was a time in Carteret County we didn't have this kind of teamwork and effort and everybody working together. So I think that's one of the important things to notice about today. We understand that the fight against illegal drugs requires a comprehensive approach. It requires education, prevention, intervention, treatment, and tough enforcement. And in Carteret County, we believe in all of those aspects of an investigation and a prosecution. Convicted first offenders generally get the opportunity to make their first encounter with the criminal justice system their last encounter. We have a system in North Carolina under North Carolina statute where first offenders are given the opportunity to receive a probationary sentence and to follow strict sanctions, to attend drug treatment, community service, house arrest, and other severe sanctions, and given an opportunity to come out of it with a clean record at the end of that process, if they follow all the rules and the regulations of probation. On the other hand, for repeat offenders, violent offenders, and those involved in large amounts of trafficking drugs, the plan in Carteret County in North Carolina is tough enforcement, and we believe in that as well. We believe, we believe that violent offenders, repeat offenders, and those who are charged with trafficking amount of drugs in this state require tough enforcement, and that's what we do. A conviction in court for a repeat offender or violent offender in North Carolina generally results in an active prison sentence and a high fine that must be paid. As the prosecutor, we acknowledge that charges do not automatically equal a criminal conviction, but we are committed to review every case on a case-by-case basis to be sure that justice is achieved in each case. These cases are a top priority in my office, and we will continue to work closely with Sheriff Buck, the police chiefs in Carteret County, and also Chief from Havelock, who is here today, as we follow up on these cases. The officers involved in these cases, doing the undercover investigations, they have spent countless hours in preparing these cases. During the course of the investigation, my office worked closely with them on preparing the cases for court. But now that the charges are filed, now that the folks will be arrested, our job as prosecutors really begins to prosecute these cases and to move them through the criminal justice system. As the sheriff mentioned, we have had 4 operations now within the last 2 or 3 years. And it puts a tremendous burden on the criminal justice system in Carteret County, on the jail, on my office, and on the sheriff's office. But we're committed to doing everything we can to efficiently prosecute these cases. The cases from the other operations have all pretty much moved through the criminal justice system, and those people have been handled with prosecution and have received either a probationary sentence, active sentences, or a combination of the two. So Sheriff, thank you for all your good work. Chiefs, thank you for your good work, and we look forward to continuing to work with you to finish this operation and others in the future.
Thank you, Mr. Thomas. As we all know, the drug problem continues to fuel crime and social disorder in our society. Drug addiction has increased over the past 20 years, due in large part to increased prescribing and illegal diversion of prescription medication. This epidemic has resulted in an explosion of drug dealing and drug addiction, which has led to increased crime. Deaths from overdose have vastly increased. In the year 2014, nearly 50,000 people died from drug overdose in the United States. Most of those were directly related to prescription medication. Don't take my word for it. Do your own research. Every negative statistic you can think of has vastly increased since the late 1990s and early 2000s. Addiction is up. Admission to treatment centers is up. Overdose and deaths are up. The number of babies born addicted to drugs are up. In North Carolina, the rate of hospitalizations associated with drug withdrawal in newborns increased over 600% from 2004 to 2013. People's lives and families are being destroyed. In many places, entire communities are feeling the ill effects of addiction, and taxpayers are footing the bill. The average cost for hospitalization for a drug overdose is $16,000. The average cost for hospitalization and treatment for newborns suffering from drug withdrawal is $66,000. Who do you think is paying for all of this? It's not the addicts, and it's certainly not the drug dealers. It's the law-abiding men and women of our country who have to work for what they have and who see a significant portion of their income taken from them by the government, and who have to pay higher insurance premiums, medical costs, and the like in order to pay for the costs of the negative results of drug addiction and crime. And we pay for all of this while the drug dealers are making money or feeding their own addictions, all the while increasing addiction. Due to the opioid addiction crisis, heroin dealers have flooded the market with cheap and dangerous heroin, a lot of which is cut with dangerous additives such as fentanyl produced in other countries. Heroin use has greatly increased over the past several years, and consequently overdoses and deaths have increased. The drug problem is not confined to any race, gender, or socioeconomic group. This problem knows no bounds and affects us all. Daily, my colleagues and I deal with all the negative aspects resulting from drug abuse and addiction. We see how drugs have taken good people and changed them into people that even their friends and families no longer recognize or understand. With all of this going on, we have elected officials and others in our country and our state who want to reform the criminal justice system and reduce sentences and even provide early release for what they call nonviolent drug offenders. Even those who have used firearms in the commissions of their crimes. I ask the citizens to pay attention and to not be swayed by such arguments, as these policies will only serve to make our communities less safe. Now, I do want to be clear about something, and District Attorney Thomas touched upon it. We all agree that enforcement is but one part of the solution. It is an extremely important part, but it is only one part. We all believe that awareness, education, prevention, and treatment are vitally important, and we all support efforts to increase awareness, education, and access to treatment. I'd like to end by saying one thing is for certain. In this county, our efforts will continue. Thank you.